Hey everybody, it's Rob DiNicola, Sales Director here at Tiva Medical. Today I want to discuss a topic that I feel is really underreported or there's really no conversation being had around it, I find, and that is female sexual arousal disorder or female sexual disorder. Little known fact is that 43% of women at some point in their life will suffer some kind of sexual dysfunction. And sexual dysfunction is classified as any problem during any phase of the sexual response cycle that prevents individuals or couples from experiencing satisfaction. Now, it's a pretty broad based definition, but what causes this sexual dysfunction? Well, there's a whole bunch of them, much like erectile dysfunction in men, age, vascular disease, high blood pressure, diabetes, pelvic trauma, certain medications like chemotherapy and antidepressants, and of course, menopause. So there are a whole host of triggers that can cause female sexual disorders. And symptoms are pretty broad based as well. Basically, diminished sensation or lubrication, difficulty or inability to achieve an orgasm, discomfort during sex due to dryness, and just lack of a libido. So, all of these affect quality of life, affect intimacy, and there's just not a lot of conversation out there, given the fact that there really hasn't been a Viagra in the female sexual disorder marketplace. Pfizer's Viagra changed the topic, changed the conversation for men to have with their providers about erectile dysfunction and really created Men's Health. Now, there were other treatment options out there before Viagra, but a lot of guys really didn't ask to talk about it. They were embarrassed or just thought there was nothing that could be done for it. And I think that applies to women as well. Without the presence of a female Viagra, which changes a lexicon in conversations and puts it in the forefront of patients' and providers' minds, it kind of falls by the wayside. And a lot of women tend to suffer in private, not realizing that there are a lot of treatment options out there. I think there's been more and more of a focus in the last few years on female sexual disorder, which is great. You've seen institutions like the Women's Institute of Sexual Health in Nashville, Mayo Clinic, really focusing on this, having these conversations with their patients, putting advertisement out there and really putting it in the forefront of your mind. And you've actually seen it a little bit more at a lot of the conventions that deal with sexual health. That female sexual disorder is a thing and needs to be treated. And there's a whole bunch of things that can be done to actually treat this, from drugs to hormone replacement to testosterone to sexual psychology. Everything is interrelated when it comes to female sexual disorder, and these conversations need to be had to really improve quality of life for women and for couples in general, the same way that it applies to men. Now, what we have here at Tiva Medical to address this problem is called Eros Therapy. So it was actually approved by the FDA in 2000, and Eros Therapy does work. It results in statistically significant changes in sensation and lubrication, ability to achieve orgasm, and sexual satisfaction in both women with and without female sexual arousal disorder. These improvements are likely directly related to the increased blood flow in the clitoris. Increased clitoral blood flow is thought to indirectly activate an autonomic sacral nerve reflex. And the sacral nerve reflex may trigger vaginal arterialization and vasodilation, which may explain the reported improvements in lubrication and overall satisfaction. And these improvements can be almost immediate in sexual function, or it may take several weeks. It depends on how severe it is and the patient's use of the device. But a little known fact, is that the clitoris and the penis have very similar vascularization. So the same way vacuum therapy works so well for men who suffer from ED, vacuum therapy for women actually works. And to go into some of the data that these studies have shown is that you've seen an 80% increase in overall sexual satisfaction with women who use the Eros therapy, 90% sensation, 80% lubrication, and 55% in orgasm, or the ability to achieve orgasm, which is pretty awesome. And these studies have been done and shown in multiple cases. So I'm going to take some time now and actually just show you the device and talk to you about how it works and how it might be a good treatment option for women who do indeed suffer from female sexual arousal disorder. But remember, this is a conversation that needs to be had with your provider, and there are a lot of treatment options out there, like I said, like hormone replacement, testosterone, sexual psychology. All of these things are available and should be talked to with your provider. So without further ado, this is Eros. Pretty simple device. It's actually a body here that runs on 2 AA batteries that creates the vacuum. You have an on-off switch. You have a dial that controls the amount of vacuum pressure being created. And you have a little port here that you can tap that interrupts the vacuum to make the treatment option a little bit more pleasurable. Little hose, and then this caress cup that goes directly over the clitoris. So just like with anything else, when you receive the device, you got to practice a few times. So I always recommend just lying down in bed. You gently open the genitalia to expose the clitoris, and then put this caress cup. And then what you want to do is start the device. Hopefully you can hear it. And set it to its lowest setting. And apply pressure to the clitoris. And you want to do this therapy for about 60 seconds. And then stop for 60 seconds. And basically cycle through about 5 to 10 cycles of 60 seconds on and 60 seconds off. So that is how you would start the whole process and start the procedure of reconditioning the vaginal tissues. Once you are comfortable with how it works and how it feels, basically you want to roll the dial away from you to the highest setting. Now you have full control over this, so you can find what setting works best for you and what makes you feel good. Once you find that setting, you can just tap the port here. And what that's going to do is interrupt the vacuum. And that makes it more enjoyable for the woman to actually to use the therapy. It's going to create a gentle pulsing sensation, and you want to tap every 1 to 2 seconds. Now, the therapy should last anywhere from 4 minutes if you use it continuously, or 15 to 30 minutes if you decide to go on and off with the therapy. Listen to your body. You're going to find out what works best for you. And you want to do just what makes you feel good. It should not feel bad. It shouldn't cause any bruising. It should be really enjoyable. A little known side effect of the device in some women who I've talked to who use it, some providers who have prescribed it, is that a lot of women who do the therapy actually experience orgasms because, again, you're putting a lot of sensation, a lot of pressure on the clitoris, and then when you're tapping the port, you're creating a pulsing effect, which is very enjoyable. So how do you use this? Well, I told you how to use it, but how does the treatment work? For best results, you want to use the Eros Therapy device 4 times a week. Make it part of your reconditioning, tissue reconditioning, basically. So the 4 times a week gives you a lot of time to really enjoy your therapy, and also gives you a chance for your body to respond to the protocol that it's going through. You should see results. Some see it almost immediately. Some take a few months to do it, to actually see the results. You want to plan to use your therapy for about 3 months. Again, it may take several weeks for your body to change, or it may happen overnight. Um, give your body a chance to really see the results of the treatment option. When you're done with treatment, you do want to wash these little caress cups in just warm soapy water after each use. You're going to get about 10 uses from these cups before you have to replace it with a new one. There are 2 cups that actually come with the device when you receive it, and you can purchase more online, and they're really fairly cheap. Um, Before you use the cup again, it has to be fully dry. You don't want to pull any water or moisture inside the motor of the Eros device, because that will damage it. And basically, you just clean this with a towel of warm soapy water, or you can use an alcohol wipe, whatever is easier on that. Now, Eros is only available by prescription, so you're gonna have to go talk to your provider about it, about female sexual disorder, have that conversation, and they may or may not provide you with Eros, or they may talk about other treatment options that are available. The one very good thing about Eros is that it's a fairly cheap treatment option, and the results are really there in clinical studies that have shown its ability to really help women who suffer from female sexual arousal disorder. And it's quite an enjoyable treatment option for me, from what I'm told. I'm not a woman. I'm not a girl. So, but everything out there shows that it's enjoyable and that it does work. So definitely go and have that conversation with your provider, with your gynecologist, and help get the ball rolling to improving your quality of life and bringing intimacy back to your life. If you have any questions or comments, please respond back to this blog, or look me up on LinkedIn, and I'd be happy to have any conversation or point you to any providers who actually offer Eros therapy, or who are really good at treating female sexual disorders. Thank you so much.